effect of the stressors and complexities of the coronavirus pandemic is the rise in opioid addiction. In the last 5 years, opioid-related deaths increased by 61% in the Palmetto State. This National Recovery Month, we're learning more about a new program helping more South Carolinians on their path to recovery.
A new resource is helping South Carolina families affected by drug abuse.
Talk about opioid addiction.
For National Recovery Month, state nonprofit Hold Out the Lifeline launched a new training.
Keep the faith.
It's called Community-Based Recovery Support, an intro to recovery support for all.
We want to make sure that we're reducing the stigma of addiction, as well as increasing the understanding of addiction and recovery, and encouraging others to seek help earlier.
The organization works with hundreds of churches across the state to help educate the public on critical health topics like COVID-19, the vaccine, and the opioid epidemic.
But help is available.
The new training, they're now adding recovery support.
Churches are important because so many people go to church on a weekly basis. And so we recognize that that is a pillar for many people to receive information, and particularly information that they may trust.
Through their outreach, Hold Out the Lifeline is targeting 7 areas based on the high use of opioids and the number of overdoses and deaths: Richland, Lexington, Sumter, Greenville, Spartanburg, Charleston, and Horry counties.
There is assistance to get to that place of peace.
Sarah Goldsby, director of the South Carolina Department of Alcohol and Other Drug Abuse Services, says the COVID-19 pandemic is accelerating the opioid epidemic.
The illicit opioids right now that are accessible, the fentanyl that we're seeing on the streets, is so dangerous. We're expecting to see, with our overdose mortality in September, about a 50% increase in the number of individuals who have died of overdose in this year.
On average, 130 Americans die every day from an opioid overdose. But there is a way out, and it starts at home.
Clean out the medicine cabinet, clean out the kitchen cupboard. Any unused prescribed medications need to be safely disposed of. The priority has got to be keeping people alive, making sure that everybody knows where the overdose antidote is.
Nearly 400,000 people in the Palmetto State are recovering from a substance abuse disorder.
If you or a loved one needs help, resources are available. We have more information on WLTX.com. Just click on this story.